If you're tired of having a rib flare, usually the left side more than the right, or if you're a physical therapist trying to improve your patient's asymmetrical rib cage, then this video is for you. What we're discussing is why and how this flared rib cage position happens in the first place, and one simple exercise that can start to provide instant relief. So to maximize the exercise, we first need to understand why and how this happens in the first place. It usually comes down to two primary reasons. Number one, posture. Number two, breathing patterns. So if we turn John Bones Jovi around, what we can start to recognize is that normally when we have a flared rib cage, the person's posture is usually extended through the spine and the pelvis goes into an anterior pelvic tilt. If I do it on myself, it looks like this. Now you may be thinking to yourself, I understand that if we're in an anterior pelvic tilt that the ribs go up, but I'm not dealing with a bilateral flared rib cage. I'm dealing with a unilateral flared rib cage. Well, what happens is if we go into this flared extended position, to really have that flare on one side more than the other, there's usually a degree of rotation. So if I go through it myself, if I arch my back, flare the rib cage, but turn slightly to the left, the result of that is that the left rib cage is going to open up more. This right rib cage is going to close down more. So this gives an illusion that this left is higher while the right is lower. The second part we need to consider is breathing. Now, for normal breathing to occur, what we're looking for is the rib cage to expand anterior to posterior and the rib cage to expand laterally, and the belly will move simultaneously. Now, notice how I'm not saying that it's only the belly. This is actually the problem. When we're in this extended posture, muscles are compressing anterior to posterior. And as a result, it's really hard to actually expand the chest wall, which is another way of me saying expand the lungs. So what happens as a result? If we can't move here, the brain always finds the path of least resistance. The less resistance is below at the belly. And so this is why we get so much of our belly breathing. Now, the problem with that is that it turns into a pattern. So patients never start to truly expand the chest wall, and they only move through their belly. Well, if they're in this flared rib cage position, they just learn to stay there. And so it's a learned pattern that if I stay here, I can just breathe through here. So we're not doing anything to start to bring this rib cage back down. And so that's why to really fix the source of the problem, we need to start to understand what position am I starting in and how am I breathing in that position. So what are we going to want to do as far as an exercise perspective? We want to change our position. We want to get out of this extended, slightly rotated posture. Then we need to learn how to breathe in it. So with that, let's jump into our exercise so you can see exactly how we want to execute it. So this is a 90-90 breathing exercise. Not only is it really simple to perform, it's actually really effective. Part of the reason why it's so effective is because the overall position that we put either ourselves or our patients into. That position makes it really hard for them to compensate. What I mean is that what usually wants to kick on, such as necks and low backs, is in a position that it doesn't have the leverage to do so. So with that said, let's jump right into it and start with what we'll need, right? So what you're gonna want is some sort of pillow, yoga block, something to elevate the patient's or your own head. But what you're gonna wanna find is that it might need to be higher than you would typically use. It's okay, they'll be in a little bit of a forward head posture, but as they bring their arms up and go through the exercise, that forward head will turn into a neck that is nice and relaxed. Second, we're gonna need some sort of bar. If you don't have a squat rack, you can use a bar from a cable machine, a rope, a handle, something that a cable machine would have. Lastly, we're gonna want a bench. We're going into a 90-90 position, and so 90 degrees of knee flexion, 90 degrees of hip flexion. With that, it's pretty straightforward. As you go down, you're gonna grab onto the bar, you're gonna throw your feet up on top. You can put a ball between the knees if you want. And all we're doing is finding the position where the head can be relaxed. Notice how the head's relaxed, it's not off, but I look really rounded, my shoulder blades are off the ground. From here, we're gonna go into a slight pelvic tilt or belt buckle towards the chin. This would be extension, that's what we're trying to fight. That would be quote unquote wrong. We're gonna search for that, more rounded. We're gonna find a little bit of hamstrings by digging down into the bench, and then all we're doing here is breathing. So we're just gonna inhale through our nose. We're gonna exhale. And there's gonna be two cues that I like to use. We need to exhale until we feel our rib cage come down. And number two, if you do that correctly, you will feel an increase in an upper to mid back stretch. So if your patients or yourself, if you're going through this and you don't increase the stretch, we didn't exhale strong enough. So as we go through it, we inhale, we exhale, we find that stretch. Now the money of this exercise is then inhaling and maintaining that downward rib cage. Why? Because the ribs want to flare. And so what we're doing is we're teaching them eccentric strength. When I say them, I'm referencing the abs. Eccentric abdominal strength. And then we just repeat that. So every time we exhale, the ribs come down, we feel the abs. Every time we inhale, we maintain that ab tension. Whole time we're not losing the hamstring. Now to make this a little bit more specific to a left rib flare or a right, if that's what you're dealing with, you could add a little bit of a hip hike. So you can go on that left side and think about the left pocket coming up towards the left shoulder, and then we're holding on to that. And so what we're doing here is we're just giving a little bit more leverage to those left obliques so they can hold those left ribs down more so they can learn this new pattern. Welcome back. I hope you find that exercise to be useful, whether it's for yourself or your patients. Here are some of the key reminders that we really want to make sure that we hit on while we're going through the exercise. First, we need to make sure that the neck is supported. We can't have the neck all the way down because it's pulling them in such a dramatic stretch through the spine and the rib cage. We need to start with the head more elevated than we typically would have. This will allow the neck to relax and to make sure that we're not starting to teach poor patterns. Next, we really want to make sure that the breathing is emphasized. This is a breathing drill. So we need to make sure that on exhalation, the rib cage comes down. On inhalation, we're maintaining that downward rib cage. What we're doing is we are training that flared rib cage that we're trying to fix, how to get stronger eccentrically through the abs. This is one of the keys to starting to create a new pattern. And finally, make sure they remain in that tuck and with a little bit of hamstring tension. What is this doing? This is bringing the center of mass back so we can maintain a good position while we start to breathe through it.